Hi, my name is Mercy John. I am a student, family nurse practitioner student with UT Arlington. I'm going to do a head-to-toe assessment on you.
Okay.
Let me first wash my hands. Uh, can you uh, can you tell me your name and your date of birth?
My name is Abby John and my date of birth is May 2073.
Mr. John, do you know where you are right now?
I'm at home right now,
Can you tell me the today's date, which day, and what is the time right now?
October 26, 7 o'clock p.m.
What is your mood? How do
I'm
you feel?
okay. I'm okay now.
Mr. John is a 43 years old male. Uh, He's alert oriented to time, place, and person, and he states his mood is good, and his which is congruent with his affect. His dressing is okay with the setting. Okay, now doing the inspection on your skin, the skin is even and symmetrical, and there is no lesions and no adhesions or uh, any swelling noted. Checking the skin turgor, there is instant recoil. Uh, can you show me your nails? The nails are well groomed, and there is no lesions, no pitting, and um, checking for the capillary refills. The capillary refill is less than 2 seconds. Uh, Okay, inspecting the uh, hair and the scalp. The hair is evenly distributed, and there is no scarring, and no inflammation seen on in, on palpating the scalp. Do you have any pain here?
No,
The scalp is non-tender. There is no lesions or any marked or any bumps seen. Inspecting the head, neck, and the lymph nodes. The head is round, normal, cephalic, and facial features are symmetrical. The There is no thyromegaly, and there is no distension. Okay, auscultating the thyroid and also palpating the thyroid. Okay, can you swallow for me? Can you look to the left and swallow for me? Can you look to the right and swallow for me? Okay, when the patient swallows, I can feel the thyroid cartilages, and it is without any nodules or any masses. And the trachea is midline. Auscultating the carotid pulse bilaterally. There is no Breuer's auscultated. Palpating the lymph nodes bilaterally, occipital. Uh, do you have any pain here?
no,
Pre-auricular, post-auricular, tonsillar, anterior cervical, posterior cervical, submandibular, submental, supraclavicular, axillary, epitrochlear. Do you have any pain on any of these palpated lymph nodes?
no.
So the lymph nodes are non-palpable and non-tender. Okay, coming inspecting the eyes. The eyebrows are evenly distributed over both the eyes, and the eyelashes are evenly distributed over both the eyes. Eyelids are symmetrical, and there is no ptosis seen. The sclera is white, conjunctiva is clear, iris is brown bilaterally, pupils are round and equal bilaterally. Can you close your eyes, Mr. John? Any pain?
No,
So the eyeballs are firm and intact, no masses or no pain, no tenderness. Okay. So we have to. Then there are two types of chart that we test for the distance. One is the distance vision that is tested by the Snellen chart, and the second is the near vision tested by the Rosenbaum chart. The Snellen chart is put up like 20 feet away from the patient, and the patient is asked to close one eye and read the smallest line possible with all the letters, and so the same procedure with the other eye closed. And the numerator is the distance from the chart, and denominator is the distance an average eye can read the line. The Rosenbaum chart is used as a near vision. In this, the patient is asked to close one eye and read the smallest line possible, and close the other line and read the smallest line possible. Now I need to check the inside of your eye. I have to look for the optic disc. So I have to use the help of ophthalmoscope, and patient's right eye has to be checked with my right eye. Okay, to the number 9, turn the wheel and make it number 9. That's comfortable for me. Okay, bracing the eyelid, upper eyelid of the right eye. I'm moving my right eye into the patient's right eye and looking for the red reflex and moving it in and looking for the optic disc. Similarly, patient's left eye has to be examined with my left eye and brace the upper eyelid, follow the red reflex. The optic disc is well marked, edges are clear, there is no nicking, there is no hemorrhages noted. Checking for the accommodation. Okay, can you follow the slide? The pupils in both the eyes constrict and accommodate when the patient follows the pen light. Checking the direct and consensual light. When the pen light is shined on the right eye, the pupils constrict on the left eye, and when the pen light is shined on the left eye, pupil constricts on the right eye. For the corneal light, shine the light on the bridge of the nose, and the light shines into the pupils. Cover and uncover test. Can you cover the left eye for me? No nystagmus noted in the right eye. Can you please cover the right eye? No nystagmus noted in the left eye. Extraocular movements of the eyes has to be seen in the 6 cardinal fields. Please follow this pen light and do not move your only your eyes. Don't move your head. Okay, the pupils are equally round and constricted. They can follow in 6 cardinal fields. Inspecting the ear is in line with the outer canthus. The upper pinna is in line with the outer canthus of the eye. And when palpating the pinna and the mastoid process, do you have any pain here?
No.
There are no masses, no lesions, and they are non-tender. Okay, now I have to look in the ear canal with the help of the otoscope. The ear canal is without any. There is no drainage. There is no erythema. There is no foreign body. The tympanic membrane in the right ear is pearly gray, and the cone of light is at 5 o'clock. On the left ear, the ear canal is without any exudate. There is no drainage. There is no foreign body, and the tympanic canal is pearly gray, and the cone of light is at 7 o'clock. Okay, next I have to do the whisper test. Okay, Mr. John, can you cover your right ear and wiggle, and I will say a word, and then I will whisper a word and you have to repeat after me.
Ice cream.
Okay, can you do with the same on the cover the left ear and wiggle it?
Pineapple.
Okay, the whisper test is done. Now inspecting the nose, mouth, throat, and the sinus. The nose is midline. The septum is intact. Okay, can you close one of the nostril and breathe through the other nostril? Okay, can you do with the other? The nostrils are okay. The nostrils are patent. To inspect the inner side and the internal nose. Okay, brace. The internal turbinates are moist and pink. Okay. Can you open the mouth? I want to count the number of teeth. Open your mouth. Okay, the gum is moist. The gum is moist and there is no lesions. Teeth is 32 in number and there is no dental caries. Lip is symmetrical and pink and moist. There are no lesions. Can you lift your tongue up? The frenulum is intact, symmetrical. Yeah, you can relax. Frenulum is intact, symmetrical, and the tongue is pink and moist. and the buccal mucosa is moist and no lesions noted. Can you say ah for me? Ah. Okay. The tonsils are 1 plus. Uvula is in the midline and rises on phonation, and there is no exudate seen, and pharynx is pink. Okay. Okay. Take a tissue, please. On inspecting the chest is even and symmetrical. No overly prominent ribs seen. Respiratory rate is 18 breaths per minute. Uneven, no, even and unlabeled respiration. Uh, I have to do the percussion. Starting with the posterior. Okay, raise your arms up. Okay, bring it down. On percussion, tympani can be heard over the ribs, heart, and the diaphragm, and the resonance over the peripheral fields of the on the lung fields. The auscultation also starting from the posterior side. Open your mouth and take a deep breath. Raise it up. Put your hands down. On auscultation, bronchial breath sounds can be heard over the trachea, where expiration is greater than inspiration. Uh, uh, Under the clavicle, bronchovesicular sounds can be heard, where expiration is equal to inspiration, and over the peripheral lung fields, vesicular sounds can be heard, where inspiration is greater than expiration. Okay, and listening and inspection for the heart, there is no thrust or lift seen. Okay, can you lie down? Palpating for the precordium. Check the apical pulse for 1 minute. No thrills or heaves seen. Heaves felt. Can you sit up, please? Okay, listening, auscultating for the heart sounds. aortic, a second intercostal space, right sternal border, S2 is greater than S1, pulmonic, second intercostal space, left sternal border, S2 is greater than S1, Erb's point, third intercostal space, S1 is equal to S2, tricuspid, fourth intercostal space, S1 is greater than S2, left sternal border, mitral, a fifth intercostal space, mid-clavicular line, S2 is S1 is greater than S2, and the apical pulse can be heard for 1 minute. It's 86 beats per minute. Rate and regular. Rate is regular, and rhythm is regular. Okay, so the heart sounds can be heard in three positions. One is supine, supine sitting, and left recommend position. The difference between the bell and the diaphragm of the otoscope is with the bell of the otoscope we can hear the low pitch sound, and with the diaphragm high pitched sound can be heard. Next, checking the blood vessels, temporal palpated bilaterally, brachial palpated bilaterally, radial palpated bilaterally, dorsalis pedis palpated bilaterally, and posterior tibial palpated bilaterally. So they are plus 2 plus, and that's expected. Inspecting the abdomen. Can you write down? Okay, take a look. At the eye level, the abdomen is symmetrical, the contour is flat, color is consistent with the rest of the body, no superficial humps seen, and the abdomen, the four quadrants are divided on auscultation. We have to auscultate on the four quadrants of the abdomen. On auscultation, there are about 5 to 35 times vowel sounds heard per minute, and auscultation with the bell of the stethoscope to the epigastric region. There is no venous hum. Next is a percussion to the four quadrants. On percussing, the timpani is timpani can be can be heard on the air-filled organs like stomach and intestine, and dullness over the solid organs like liver and spleen. Okay, percussing for the liver span. from the area of the tympani, from the area of the tympani, percus upward to the right midclavicular line, where the tympani changes to dullness, and that's the point of the lower border of the liver. Mark that area. And from the area of the resonance uh, down to the mid-clavicular line, the area of resonance, then the sound changes to dullness. That's the area of the upper border of the liver. Mark that area. And this is in between the 5th to 7th intercostal space. The measurement between the two mark is between 6 to 12 centimeter, and right now it is 7.5 centimeter. Checking, palpating the spleen. Okay, with the deep palpation, usually the organs of usually the spleen, they bump into the examiner's arm, hands on inspiration. Okay, can you sit up, please? Okay, Mr. John, can you walk? Check. Yeah. Looking for the posture in the gait. The posture is even and symmetrical. And I have to look for the scoliosis screen. Can you come here? Can you come here and bend your toes? Stand up and bend at your toes. Bend the knees. Okay. There are no rib humps. The shoulder, hips, and the scapula is even, so the scoliosis screen is negative. I have to check the passive range of motion and the active range of motion of the ankle. Can you dorsiflex this way? Can you plantarflex? Can you inwardly rotate? Can you externally rotate? Okay, now passive range of motion, dorsiflex, plantarflex, internal rotation, external rotation. Okay. Okay, now the cervical flexion. Can you bring your chin to the chest? Can you hyperextend? Can you turn your chin to the left side to shove left shoulder? Touch it. And can you bring your chin to the right shoulder? Okay, and can you bend your ear to the left shoulder? Can you bend your okay. Now passive range of motion. Okay, now elbows. Can you flex and extend? Similarly with this right hand. Passive range of motion. Okay. Can you bring your fingers down? Not that way. Only the fingers. Only the fingers. Up and back. Okay. Passive range of motion. Okay. Can you touch the tip of the fingers with the thumb? Similarly with the other hand. Can you touch the base of the little finger with the thumb? Similarly with the other hand. Okay. Make a fist with this right hand. Okay, relax. Make a fist with this left hand and relax. Okay, can you spread out the fingers and bring it closer and relax. Okay, can you take your arms up and bring the wrist down 90 degree like this and up and back and relax. Okay, can you lie down on the table? Now checking the hip flexion. Can you bring the right leg up? Okay, and relax. The left leg up and relax. Okay, passive range of motion. Relax. Can you bring the right knee to the right chest? Right knee to the right chest. Okay, and relax. Left knee to the right left chest and relax. Can you lie down on your back? Can you bring your bring your leg back and relax. The other leg back and relax. Okay, can you come back, please? Okay, can you bend your right knee and relax? Can you bend your left knee and relax? Passive range of motion. Okay, can you bring your right ankle to the left knee? Right ankle to the left knee. Okay, and left ankle to the right knee and relax. Passive range of motion. Okay, can you get up? I want to check your knees flexion and hyperextension. Can you stand here? Okay. Can you bring your knees back? The other leg. Passive range of motion. And that hyperextend. The other leg. Passive range of motion. Okay, can you sit, please? Okay, so checking the range of motion of your shoulders. Can you raise your arm up above over the body and relax and bring it behind your body and relax. Take to the side, bring both the arms to the side of the body and relax. Bring the arms behind your hips and relax. Bring your hands behind your head and relax. Okay. Now checking the neurological testing. Optic nerve 2 is sensory and which is intact, which is evidenced by the vision test. Optic nerve 5 is trigeminal, sensory and motor. This is done by the sharp and the dull sensation. Can you clench your teeth hard and the jaw is palpated, which is intact. Okay, show your hand, please. Okay, now I'm going to put the now I'm going to show you. This is sharp and this is dull. So with your eyes closed, you need to tell me. Don't close the eyes now when I tell you. With the eyes closed, you need to tell me if the sensation is sharp or dull. Uh, Dull. Okay. So please close the eyes.
Sharp, dull, sharp, dull.
Okay. Open your eyes. So the trigeminal nerve is intact. Now, cranial nerve number 7 is facial, that is sensory and motor. Can you taste the difference between salty and sweet?
Yes.
It's okay. Okay, and the facial nerve is tested by the facial making of faces. Can you raise your eyebrows, please? Can you wrinkle your forehead? Can you puff out the cheek? And okay, can you smile but don't show your teeth? Okay, show me your teeth. Okay, there is the facial nerve is intact. Cranial nerve number 8, vestibulocochlear, is sensory. This is tested by whisper test. It is intact as evidenced by the whisper test. Cranial nerve 9 and 10 is glossopharyngeal and the vagus nerve. That is sensory and motor. That is intact as evidenced by the uvula is midline. Then the patient can swallow, and there is gag reflex, and so spinal no, cranial nerve 9 and 10 is also intact. Cranial nerve 11 is spinal accessory, that is motor nerve. So can you shrug your shoulder? Okay, push through my resistance. Okay, and like can you push through my resistance here? Okay, can you push through my resistance here? Okay, this shows that the sternocleidomastoid muscle has a strong contraction. So spinal accessory, that cranial nerve 11 is also intact. Cranial nerve 12, that is hypoglossal. Okay, is also intact as evidenced by the tongue. Can you put your tongue front and back and to the lateral sides, and push through your cheek and against my resistance on this side. So hypoglossal nerve is also it's a motor nerve. It is intact as evidenced by the tongue movements. Okay, so and I would like to do some coordination testing. So in this, again, can you you need to pat with your arms on the knees faster and faster. Yeah, fast. Okay, so that rhythmic movement is the coordination movement is intact, and also with the alternate and from the finger to nose touching, extend your hand this way and alternatively close your eyes and alternatively touch the tip of the finger to the tip of the nose alternatively and move it faster and faster. Okay, okay, thank you. So the coordination movement is normal. Now checking the sensory sensation on the lower extremities with the vibration and also with the sharp and dull sensations. Okay, with the eyes closed, this is soft. and this is sharp and this is dull. You need to tell me like which part of the body is sharp or is touched with the sharp or soft, and which part of the body it is. Okay. Okay, now close your eyes.
Sharp right leg, soft left leg, sharp right face.
Okay, thank you. Okay, next is the vibratory uh, with the tuning fork in vibration. I'll be touching the body prominences, and you have to tell me which part you feel the vibration. So can you close your eyes?
Left leg,
Okay.
right leg.
Okay. So that is also in. So the sensation, the vibratory sensation is also intact. Now I need to check the deep tendon reflex. So first we'll check the bicep tendon. So the elbows are held at 45 degree, and the bicep tendon is and the hammer is striked on the thumb. The elbow will produce the elbow flexion. Similarly, on the right arm, the elbows will produce the flexion. Next is brachioradialis reflex. Okay, strike on the forearm is pronated and strike on the brachioradialis tendon, and elbows produces a flexion and the arm produces a flexion. Similarly, on the right arm, okay. Next is testing the triceps reflex. Hang the elbows this way and strike at the tricep tendon. You can see the elbow extension. Similarly, do with the left arm, and you can see an elbow extension. Now patellar. Now it is a patellar reflex. You can see extension in the lower part of the leg. Extension in the lower part of the leg can be seen. Next is the Achilles tendon reflex. Hold the heel, brace the heel, and strike the Achilles tendon. You can see the plantar flexion of the foot. Similarly, on the left leg, brace the leg uh, and strike the Achilles tendon, and you can see the plantar flexion of the foot. Plantar reflex. Okay, strike uh, uh, the lower portion of the feet from the heel to the medial surface and then to the lateral side, and you can see the plantar flexion of the foot and the fanning of the toes. Similarly, with the left from the left leg. Yeah, I have to do some special test, anterior drawer test. Can you lie down? And can you flex your knee? Okay. In this, the fingers are behind the calf, and the thumb rests on uh, the tibial plateau, and a sudden forward motion is given on the tibia, which is to see if there is laxity of more than 6 to 8 millimeters. Similarly, do with the other leg. Come closer. Okay. Can you sit up? Next, I want to do a tactile fremitus. Okay, can you repeat 99 for me? Can you repeat 99 for me?
99, 99, 99, 99.
Vibration is same on both the sides.
99, 99, 99.
Okay. Checking the Weber and the Renet test. I'm going to put the fork is in vibration, and the base of the fork will be on the skull. So you need to tell me if you can hear the vibration equally in both the ears.
Yes.
Okay, that's Weber's test. Renet test. Okay, so I'm going to place the base of the tuning fork on the back of the ear, and you need to tell me when you can stop hearing the sound, stop feeling the vibration, and after a few minutes I'll bring it in front of the lateral to your ear, and then you need to tell me when you can stop hearing the vibration.
Yes. Stop.
Okay. So here the air conduction takes twice as much sound, twice as much as time from the bone conduction. Maxillary trans illumination test. And this is better done if the light is turned off. In this, the light is shined over the lateral side or lateral aspect side of the nose, and beneath the medial aspect of the eye, and the patient is asked to open the mouth. Can you open your mouth? And the trans illumination of the hard palate is seen. Okay, can you lie down? Here. Next is the Murphy sign. On deep palpation under the costal margin, if the patient and the gallbladder is inflamed, and if we deeply palpate on inspiration, the patient will stop inspiration because of the pain. That means that there is positive Murphy sign. But here, the patient on inspiration doesn't have any pain. That means the patient that is negative Murphy sign. Mr. John, can you get up, please? Okay, can you stand here? I'm going to just push you. Okay, he's not falling back, and his gait is normal, so it's negative for Romberg. Thank you.
എത്ര സമയം